Hello everyone, I am here in this video to explain about the important structures. Now when you get an X-ray peer view, what we should do is that we should start seeing X-ray from the outside to inwards. Yeah, from the both sides. This is the right and the left side. Why do we do this? This because we want to see some important structures like the scapula, the clavicle. Here also the scapula and the clavicle. Then we see here the subcutaneous tissue, because if a patient has a chest tube in situ or the patient has a trauma, there will be air gas shadows seen under the soft tissue. There we can see the patient is having subcutaneous emphysema. This is very important. So most of the times we miss this part. Then we go a little inside. We see the CP angle. This is the costophrenic angle. This is a CP angle. This is the left CP angle. This is the right CP angle. Next, we go inside. We take a gross look on the ribs and the parenchyma. Here we see a gross look on the ribs and the parenchyma, whether there is any fracture and what kind of other abnormalities we see in the parenchyma. Usually what happens when you get an X-ray, we directly jump to if there is any opacity here or consolidation or any collapse, something is there or a cavity is there. We directly jump to this thing and we miss other important structures that are relevant also. So to avoid this, start seeing X-ray from outside to inwards. It will give more valuable informations. Then we come a little bit inside. We see this cardiophrenic angles. The left cardiophrenic angle, this is a right cardiophrenic angle. Okay. Now the mediastinal structures that we see mostly is formed by the heart and the vessels of the aorta and the pulmonary trunk, and here the trachea. Now, how to understand which border of the cardiac shroud is found by the which chambers of the heart? Now, this is a bit tricky, but I'll make it very simple for you. You see this. This is the right cardiac border. This is formed by the right atrium. This in the left side is found by the left ventricle. This that is lying on the diaphragm, this is formed by the right ventricle. Now how to make out the chambers? Now you join this, and this is the right atrium, this is the right ventricle, this is the left ventricle. As like it's very easy. Now you can make out which border is found by the which cardiac chambers. Now you see these hazy structures on the left side. Yes, these are nothing but pulmonary vessels. These are the pulmonary vessels. This is the main pulmonary trunk. This is the main pulmonary trunk. This is the branches. This is the upper branch, the lower branch. On the right side, on the left side, this is the upper branch. This is the lower branch. This is the left main pulmonary artery. This is the right main pulmonary artery. Now, other important structures that we see is that this from the left ventricle, which structure? Another important thing that we miss is here this one. This is the left. This part of the cardiac border is formed by the left atrial appendage. Left atrial appendage. Yes, this is important. Now what we see is the structure that is arriving from the left ventricle. This is the aorta. This is the ascending aorta. Here goes the descending aorta, and it goes like this. Yes, these are the branches of the aorta. Now this is the ascending aorta, this is the descending aorta, and this part is formed that is called the aortic knuckle. This is from the aortic knuckle. Okay, now you understood which part is the aortic knuckle. This part is aortic knuckle, this part is left atrial appendage. Now if you want to know the other structures that are quite relevant, is here goes the superior vena cava, here goes the inferior vena cava. This is the superior vena cava, it drains in the right atrium. IVC drains in the right atrium. In the mediastinum, that is mostly I have told all the structures, all the borders formed by the cardiac chambers. Now, this is mainly the trachea. I think I covered most of the structures that are normally seen in chest X-ray. Now in the next video, I'll start the abnormalities, what we see in clinical settings. Okay, thank you.